All right, everyone. Welcome to our final prize presentation for our virtual Grand Hack 2020. We are super excited to have you all here. We had a really great time hearing all of your pitches and learning about all of the great things that you guys have been working on this weekend. And we really appreciate, everyone from every time zone who has stayed and stuck around to be able to listen to these. So without further ado, let's get started. So before I go into the prizes, I'd like to thank all of our sponsors for our Grand Hack 2020. Without you guys, this really could not have happened. And we really appreciate all of the time and effort that you put into constructing the challenges, as well as all of the effort that you put into helping the participants as they progressed this weekend. So thank you again for all of your help. We really appreciate it. As a recap of the prizes, we have 3 prizes in each track, first, second, third place. We also have the Intersystems Healthcare Technology Challenge, which has 2 winners, a winner and a runner-up, as well as the Brigham Health Popey Prize of $1,000 and a prize from the PathCheck Foundation, which applies to teams from Track D. Now, before I get started with going into the prizes further, I'd also like to talk a little bit about the partner hackathons that are upcoming that we are going to be helping with. So while MIT Hacking Medicine's flagship event is this Grand Hack, we also do help out with other partners who are interested in hosting healthcare hackathons around the world. And so there are 3 events that are upcoming that we'd like to let you guys know about and encourage you guys to apply and participate. The first is the MIT Hacking Racism in Healthcare event. MIT is hosting a virtual hackathon to empower the broader community to take action on the racial inequities that are structurally existent in healthcare. Please join us October 16th to October 18th to break down these barriers. This initiative is being put together with partners from across the MIT and healthcare ecosystems. In this event, participants will form diverse teams to generate executable solutions to address the role that systemic racism plays in health disparities. We'll get together to develop solutions that break down racial barriers in healthcare, resulting in positive health outcomes for all. If you are up for the MIT Hacking Racism Challenge and want to join our community in leaning into these issues as either a participant or mentor, please sign up at hackingracism.mit.edu. Applications are due October 13th. In addition, as a preview of the topics that will be covered at the MIT Hacking Racism Hackathon, the topics that have been decided on are healthcare workforce leadership, clinical research and trials, healthcare education, social justice, public health, population health, healthcare disease-based disparities, and mental health, physical health, and socioeconomic health. So we look forward to seeing a lot of you apply to this. The next partner hackathon that will be held is with the Oregon Health and Sciences University to address problems in the medtech tracks of surgical care and early disease detection, or the digital health and health IT tracks of rural and low resource setting healthcare and management of chronic conditions. $40,000 in prizes will be awarded to the most promising teams, with a special emphasis on reducing health disparities and addressing COVID-19. Anyone with an interest in improving healthcare is invited to join the clinicians, researchers, designers, investors, and many others joining this dynamic weekend event. Propel an idea into action. Apply by October 14th by going to inventathon.org. Also, on October 23rd to the 25th, we will be hosting a hackathon with Hacking Dermatology, which aims to shine a spotlight on skin health and to the most pressing challenges for patients living with dermatological conditions. Visit the Hacking Dermatology website at hackingdermatology.org for more information about the event and to apply as a mentor or participant. All right, and so let's get into the part that I'm sure you guys are anticipating the most. The first prize that we would like to announce is the runner-up of the Intersystems Healthcare Technology Challenge. And I'd like to announce that that prize goes to Engage. Engage address the problem of senior citizens suffering a lack of connection with the community and absence of stimulating activities. This is where Engage comes into play. They provide a platform for senior citizens to find mental stimulation, volunteering opportunities, and a community where they can find like-minded people. Congrats to Engage. The winner of the Intrasystems Healthcare Technology Challenge is CareShare. The sandwich generation of adults are responsible for raising their own children and for the care of their aging parents. As a result, they suffer from burnout as they have inadequate access to timely and convenient care support. CareShare aims to solve this problem by using an on-demand app to instantly connect caregivers with the backup help that they need when they need it. Congrats again to CareShare. The winner of the Brigham Health POPI Prize of $1,000 is Breast Cancer Care Plan. They attempted to solve the problem of patients are not engaging in cancer survivorship care plans to improve quality of care. They solved this by automating survivorship care plans to keep up to date with plan and follow-ups. Congrats to Breast Cancer Care Plan. And our final special prize for this event is the PathCheck Foundation prize. The winner of this prize is Vector from Track D, who attempted to solve the problem of COVID-19 has wreaked havoc on millions of people globally and exposed the glaring flaws of a healthcare system reliant on fragmented and antiquated data systems, and the world that was utterly unprepared for what Dr. Anthony Fauci calls an incoming pandemic era. They solve this by creating a disease-agnostic application that puts public health data in your pocket, bringing infectious diseases to the forefront. Congratulations to Vector. And now for the track-specific prizes, I am going to be turning this over to the track leads who have been helping all of the participants in their tracks work together during this event. So the first set of track leads that I'd like to call up are for the Customized Cancer Care track, which was sponsored by Sanofi Genzyme and InterSystems. Can we have Alan?
Hey everyone.
All right.
So the third place for the customized cancer care track is Oncodoc. Patient treatment options are often decided quickly without educated patient input and are frequently siloed by medical institution. They propose a cloud-based app that utilizes FHIR standardized databases to consolidate medical information, treatment plans, and patient-driven communication across medical providers, regardless of EHR, provider, or medical center. Congrats, Oncodoc. Second place, Village Care. Ideally, each care provider would pop in daily, ask relevant questions, monitor vitals, and make adjustments accordingly. Physically, this may not be possible, but with Village Care, we believe we can get pretty close. And so the breast cancer solution is an EMR integrated secure app with alerts from smartphone generated daily vitals that drive an algorithm to best support patients and the care team in customizing treatment plans and suggesting applicable clinical trials. Congrats, Village Care. In the first place for the customized cancer care track is Oncotwin. Glioblastomas are the most invasive type of gliomas, which is a type of brain cancer that grows rapidly and have high probability of recurrence. Oncologists treating glioblastomas need to make use of abundant amounts of heterogeneous information about the tumor morphology, genetic profile, and how it fits into what is known about glioblastomas and treatment options. Treat it in the past and fine-tunes it to each individual patient given data points collected about his or her tumor, genomic profile, CT scan, and response to treatment. Congrats, Oncotwin.
All right, congrats to all of the winners of the Customized Cancer Care track. Now we'll be moving on to the prize presentations for the Digital Clinical Measures of Activity track, which was sponsored by DIME, Pfizer, and InterSystems. I'll turn it over to the track leads of track B.
Yep, I'm really excited to announce the winners for Digital Clinical Measures of Activity track. The third place winner was My Birth Prep. So My Birth Prep focused on birth outcomes in the United States that have become an expensive, deadly problem. And they created an evidence-based solution to save patients' lives and save insurers money with a novel smartphone app. Congratulations. And the second place prize goes to Lifesavers. So suicide is hard to detect and prevent, and 48% of survivors decided to commit suicide within 10 minutes. So a passive tracking app is developed by this team to detect acute behavior changes prior to suicide attempts using existing activity trackers to prevent suicide attempts within the short window of time in which they happen. Congratulations to Lifesavers team. And the first place is SmartSock. So SmartSock aimed to tackle peripheral artery disease, or PAD, a debilitating disease due to the gradual buildup of atherosclerotic plaque. Sorry, I cannot pronounce things. Plaque in leg arteries where blood flow is jeopardized. They created a sock that has sensors to track the maximum amount of steps taken per interval and the added temperature sensors along the sock to detect abnormalities in blood flow. Congratulations to all of the winners.
Congratulations again to all of the winners of Digital Clinical Measures of Activity. We'll be moving on to the winners of the Future of Aging track, which was sponsored by Meiji, Benchmark, Sanofi Genzyme, and InterSystems. I'll invite the track leads of track C to come up to present their awards.
Hi everyone. So before we go ahead and announce the prizes, we just wanted to quickly say again that we are so proud of all of you guys. The judges had a really difficult time trying to choose who the winners were, and we in fact had to break multiple ties. And so without further ado, I want Julia to go ahead and announce the winners.
So starting with third place, we have virtualhug.ai. The problem they address is that caregivers don't have a reliable way to track the physical or mental health of elderly individuals living in isolation. Their solution was an efficient and easy way to monitor the mental state of elderly individuals and a platform for caregivers to express affection, attention, and positive reinforcement. Congratulations again to virtualhug.ai. Next, we have second place. Second place goes to POP3D. The problem that they tried to solve was that pelvic organ prolapse, which affects 1 in 5 women, is sometimes treated with a vaginal pessary. But standard-shaped pessaries do not easily fit women, causing the need for multiple fittings, pain, discomfort, vaginal erosions, or ulcerations. Their solution was creating a 3D printed vaginal pessary, unique to each woman, that fits her without complications. Congratulations again to POP3D. And finally, for first place, we have Diasense. Their question was, how do we ensure early detection and diagnosis of foot complications arising from diabetic peripheral neuropathy, such as gangrene and foot ulcers, that poorly affects the mobility and quality of life in high-risk elderly patients suffering from diabetes? Their solution was Diasense, a remote early diagnostic tool using vibration and temperature perception testing to monitor progression of diabetic peripheral neuropathy. Congratulations again to all of the teams, and great work.
Congrats, track C. And we're going to move on to our final track, Access to Healthcare During COVID-19. This track was sponsored by us at MIT Hacking Medicine, as well as Takeda and InterSystems. I'll pass it on to the track D leads.
Thank you. Before I get started and announce the awards, I just wanted to say that I want to give a huge shout out to everyone in Track D. You guys all worked super hard throughout the entire weekend, and it was so incredible for us, me and Fatima, to see just how far you guys progressed. We were really proud of what solutions you guys came up with, and without further ado, let's get into the announcements. So for third place, we have
Mimi. which addressed the issue of the majority of post-COVID-19 survivors present pulmonary complications.
Mimi improves lung function by providing a virtual snorkeling experience while emphasizing deep breathing techniques.
Congratulations.
And for second place, we have
CareShare. The sandwich generation of adults are responsible for raising their own children and the care of their aging parents. As a result, they suffer from burnout as they have inadequate access and support to timely and convenient care.
At CareShare, an on-demand app, we constantly connect caregivers with the backup help they need when they need it. And then finally, for first place, we have
Mama on Wheels. This in-person prenatal checkups in the US, including ultrasounds, are being skipped due to the risk of COVID-19 exposure.
Mama on Wheels brings prenatal care, ultrasound, and lab collection over to the doorsteps of the woman in a safe and thoroughly sanitized vehicle equipped with health providers. Congratulations again to everyone in Track D, and we hope to see you guys in the future and can't wait to see where you take your ideas.
All right, so once again, thank you to everyone who has attended and congratulations to all of the winners. We'd like to say, if you guys would like to continue with your idea, regardless of whether you won or not, we highly encourage that you schedule your next team meeting with the team that you formed this weekend before you leave. It's not necessarily about winning, it's that you have that passion and charge to be able to continue with your projects and make your ideas a reality. We will also be offering some post-hack prizes. We have a few things that we're planning for programming to be able to support teams as they continue with their ideas. And so please be on the lookout on our mailing list for more information about post-hack. And also join our mailing list and stay up to date by going to hackingmedicine.mat.edu. And so that concludes our prize presentation for this evening, morning, wherever you guys are in the world. I'd like to say for all of the winners, if we will be reaching out to you by email and by Slack to let you know about further steps, and we will be good to go from there. So congrats again to everyone. And we would all like to give you guys from the MIT Hacking Medicine organizing team a huge round of applause for everything that you guys have done this weekend. And we hope to see you guys at our future events.